What do abnormal Pap smear results mean for you? Imagine sitting in your doctor's office and hearing that your Pap smear results are abnormal. That can feel unsettling, but it's important to understand what that really means. An abnormal Pap smear indicates that some cells taken from your cervix look different from normal cells. This does not mean you have cancer. Instead, it signals that there are irregularities that need further evaluation or monitoring. Abnormal results are quite common and are often caused by infections, inflammation, or changes related to human papillomavirus, which is a common sexually transmitted infection linked to cervical cancer. Pap smear tests are designed to screen for abnormal cell changes in the cervix. They aim to catch precancerous conditions early, before symptoms develop. When results come back abnormal, it means some cervical cells show atypical features. These changes can range from mild to more serious. Mild changes might resolve on their own, while more significant abnormalities could require closer follow-up or treatment to prevent progression to cancer. There are different types of abnormal Pap smear results. The most common is called atypical squamous cells of undetermined significance, or ASCUS. This means the cells look slightly unusual but are usually not serious and often linked to HPV infection. Then there is low-grade squamous intraepithelial lesion, or LSIL, which involves mild abnormalities often caused by HPV. LSIL often resolves naturally without treatment. High-grade squamous intraepithelial lesion, or HSIL, indicates more serious abnormalities that are more likely to be precancerous or early cancer. HSIL needs closer follow-up and possibly treatment. There's also ASCH, which raises concern for HSIL and requires prompt investigation. Abnormal glandular cells, called atypical glandular cells, or AGC, line the cervical canal and uterus and may suggest precancer or cancer in those areas. Other causes of abnormal results can include infections like yeast or bacteria, irritation, benign growths, or hormonal changes. Sometimes, recent vaginal medications, sexual activity, or menstruation can interfere with the test and cause false abnormal results. If your Pap smear is abnormal, your healthcare provider will recommend next steps based on the specific findings. This might include repeating the Pap test sooner to monitor changes, HPV testing to see if high-risk types are present, or a procedure called colposcopy. During colposcopy, a special magnifying instrument is used to examine your cervix closely, and biopsies may be taken from suspicious areas. If precancerous lesions are found, they can often be treated effectively to prevent progression to cervical cancer. It's crucial to remember that an abnormal Pap smear is a warning sign, not a diagnosis of cancer. Early detection through screening allows for timely intervention, which is highly successful in preventing cervical cancer. Regular screening and follow-up are essential parts of maintaining your reproductive health. While Pap smears do not screen for testicular cancer, being aware of reproductive health overall emphasizes the importance of routine checkups and prompt attention to any abnormalities. If you get an abnormal result, don't panic. Talk to your healthcare provider about what the next steps should be for your specific situation. Following through with recommended tests and treatments can make a big difference in your health. Remember, early detection saves lives, and your health team is there to support you every step of the way.